Welcome to another practice question video. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. When developing the plan of care for an infant with a cleft lip before corrective surgery is performed, which of the following would be a priority? Maintaining skin integrity in the oral cavity. Using techniques to minimize crying. Altering the usual method of feeding. Preventing the infant from putting fingers in the mouth. The answer is altering the usual method of feeding. Before corrective surgery for a cleft lip, the infant needs to consume formula. Methods for feeding may need to be adjusted to fit the infant's needs, because the infant with a cleft lip experiences a decreased ability to suck, which interferes with the infant's ability to compress the nipple. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client is also complaining of pain in the area of the ear. The client has been nothing by mouth for several days because of the insertion of a nasogastric tube. Based on these findings, the nurse suspects that the client may be developing which of the following conditions? Stomatitis, oral candidiasis, parotitis, gingivitis. The answer is parotitis. The lack of saliva, pain near the area of the ear, and the prolonged nothing by mouth status of the client should lead the nurse to suspect the development of parotitis, or inflammation of the parotoid gland. A client who is very suspicious of others, including staff, is brought to the hospital wearing a wrinkled dress with stains on the front and appearing confused. Assessment reveals disheveled, uncombed hair, flat effect, and slow movements. Which of the following would the nurse identify as the initial priority when planning the client's care? Helping the client feel safe and accepted. Introducing the client to other clients. Giving the client information about the program. Providing the client with clean, comfortable clothes. The answer is helping the client feel safe and accepted. The initial priority for this client is to help her overcome suspiciousness of others, including staff, and thereby feel safe and accepted. Introducing the client to others, giving the client information about the program, and providing clean clothes are important, but these are the lower priority than helping the client feel safe and accepted. In developing a teaching plan for the client with a hiatal hernia, the nurse's assessment of which work-related factors would be most helpful? Number and length of breaks. Body mechanics used in lifting. Temperature in the work area. Cleaning solvents used. The answer is body mechanics used in lifting. Bending, especially after eating, can cause gastroesophageal reflux. Lifting heavy objects increases intra-abdominal pressure. After determining that a client with a fractured right femur has not had any immunizations since childhood, which of the following biologic products would the nurse administer to provide the client with passive immunity for tetanus? Tetanus toxoid. Tetanus antigen. Tetanus vaccine. Tetanus antitoxin. The answer is tetanus antitoxin. Passive immunity for tetanus is provided in the form of tetanus antitoxin versus tetanus immune globulin. An antitoxin is an antibody to the toxin of an organism. A client who fell during a rock climbing trip is alert and conscious but unable to move her arms or legs on command. When planning to move a person with a possible spinal cord injury, which of the following would be the priority? Wrapping and supporting the extremities, which can be easily injured. Moving the person gently to help reduce pain. Immobilizing the head and neck to prevent their injury. Cushioning the back with pillows to ensure comfort. The answer is immobilizing the head and neck to prevent their injury. The priority concern is to immobilize the head and neck to prevent further trauma when fractured vertebra is unstable and easily replaced. The nurse is assigning care to the unlicensed nursing personnel for a client with a nasogastric tube with intermittent suction after gastric surgery. Which of the following interventions cannot be delegated to the unlicensed nursing personnel? Recording output. Securing the nasal tape. Documenting the color of the drainage. Repositioning the tube. The answer is repositioning the tube. Repositioning the tube in a client who has undergone gastric surgery should be performed by the registered nurse. The nurse teaches the client with chronic renal failure when to take the aluminum hydroxide gel. Which of the following statements would indicate that the client understands the teaching? I'll take it every 4 hours around the clock. I'll take it between meals and at bedtime. I'll take it when I have a sour stomach. I'll take it with meals and bedtime snacks. The answer is I'll take it with meals and bedtime snacks. Aluminum hydroxide gel is administered to bind the phosphates in ingested foods and must be given with or immediately after meals and snacks. The sudden onset of which of the following signs or symptoms indicates a potentially serious complication for the client receiving an intravenous infusions? Noisy respirations. Pupillary constriction. Halitosis. Moist skin. The answer is noisy respirations. A serious complication of intravenous therapy is fluid overload. Noisy respirations can develop as a result of pulmonary congestion. A client with schizophrenia comes to the outpatient mental health clinic 2 days after being discharged from the hospital. The client was given a 1-week supply of clozapine, Clozaril. The client tells the nurse that she has too much saliva and frequently needs to spit. The nurse interprets the client's statement as indicating which of the following? Delusion, requiring further assessment. Unusually reaction to clozapine. Expected side effect of clozapine. Unresolved symptoms of schizophrenia. The answer is expected side effect of clozapine. Sialorrhea, excessive salivation, is commonly associated with clozapine therapy. Clients can use a washcloth to wipe the saliva instead of spitting. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.